first things that before you're starting and embarking on a treatment, or you're exploring that you might need such a treatment before and you need to access such services, is it's important that you do a good level of research. First, it would be more introspection at your end. What are your maybe top 3 or top 5 criteria that might be important to you? There is plenty of information available nowadays. A good starting point would be to go onto the Human Fertilization Embryology Authority website or HFEA website, and that gives you the information which is published information in public domain for the outcomes, for the treatments, for the success rates for the treatments, whether it's using your own gametes, whether it's using donor gametes, or whether it's a frozen embryo replacement. It also has a comparison tool to compare a couple of clinics, so you can narrow down the search criteria to certain miles within the radius where you're looking at, use this tool and shortlist certain clinics. So if you are chasing success rates for the treatment, then that's something where you would be able to get an unbiased opinion of the different clinics and how they're performing. What is an important point to note though is that the success rates that are published may not exactly be replicable in your case, so you do have to be aware of that. It may be a useful guide, but it is only a guide. What the next important thing when you're looking for fertility clinics would be is to understand why you would need such kind of a treatment. If there are the clinics that are in your area, are they providing the kind of the services that you're looking for? You also have to then look into, besides the services being provided and besides the success rate, what other criteria is important for you. If you're a professional woman and you are constrained with your time and you would rather have more flexibility to your choices, then you need to inquire at the clinic whether there are early evening or weekend appointments, or how you would be able to integrate the treatment as part of your professional diary. So these are some of the clinics some of the aspects that you need to know when you are choosing the clinics. Very important aspect is also knowing is where the clinic is located. Can you access the clinic? Because you will have to visit the clinic at least 5 to 7 times as part of an IVF or any assisted conception treatment. The other would be is besides the opening hours, the location, do they provide continuity of care? Who the fertility specialist would be? Are you going to be able to develop the confidence and trust and hand over the responsibility of taking you through the care without going through undue stress? If you also need a female gynecologist, we need to inquire at the clinic whether they have the provision to assure you the availability of a female gynecologist for each of your appointments. So these are some of the factors you need to consider when you're trying to shortlist or identify a suitable fertility clinic for your treatment or a potential treatment in a foreseeable future.